So can you tell us, Allison, a little bit? I just shared with our viewers that Susan's actually taking advantage of 3 of some of our most popular treatments, and we're starting with a Dermaplane. Can you tell us a little bit about that?
Absolutely. So the Dermaplane is a way of exfoliating the surface of the skin, and as you can see, we're also getting some of that really fine kind of vellus facial hair, or some of that peach fuzz that we don't like. So by doing both of those things, it really kind of creates a much crisper look. And then also all your products penetrate better, stimulates that cellular turnover, and then can be combined. I'm going to sneak around.
Sure, of course. I'm going to do a little dance with you.
Can be combined then with other treatments to kind of synergistically work together and just magnify the effect of the treatment.
That's fabulous. Is there any concern about doing a Dermaplane, in the summer with the sun and whatnot?
Absolutely not. As long as you're doing the right things, protecting yourself from the sun, really there's no concern whatsoever, with doing it at this time of year. What's most important is just to really stay consistent so that you can get that benefit over time.
And when you say consistent, what might that look like? How many treatments over what period of time?
For most of our patients who are getting this type of exfoliation, ideally once a month. In our prime, in our youth, our cellular turnover is about every 28 days. So when we do something once a month, it really helps to kind of mimic that.
That's great. And we're going to combine for Susan today. We're starting with the Dermaplane, but then we're going to the DiamondGlow. Can you tell us a little bit about the DiamondGlow as well?
Yeah, for sure. So with the DiamondGlow, so it is a medical grade microdermabrasion that's really doing 3 things at once. So it is exfoliating the surface of the skin. It's extracting pores, kind of, getting that dead skin out of the pores. And then at the same time, we can infuse products into the skin, such as hyaluronic acid that we'll be using today, salicylic acid for patients who are a little more acne prone, or even a combination if that's what we really need to do.
What are other treatment combinations that we can do? Again, I know today we're going to do our Dermaplane with a DiamondGlow, some injectables as well. Are there other combinations that are popular with our patients?
For sure. Also with this, if we wanted to kind of take it even one step further, we could even add a little bit of a chemical peel to kind of, get not only the physical exfoliation, but the chemical exfoliation as well. Some patients will combine with microneedling. Again, just depending on what we're really trying to achieve. If it's improvement with texture, pore size, kind of that crepiness of the skin, scarring, lots of different things that we can combine. We can combine it with laser. Really, sky's the limit.
That's great. One of the things that I often hear patients bring up is that they're afraid to do chemical peels in the summer months. Can you address that concern?
For sure. I think just sometimes the term chemical peels can scare people because they don't know what to expect. But really, chemical peels are just a category, and they lie on a continuum, anywhere from superficial, where you might just be a little dry or flaky, to very aggressive, where we're trying to get some more work done. So in the summertime, a lot of times we will use the more superficial peels, which are totally appropriate. And, you can continue using your normal skincare without any sort of problem or issue.
That's great. Thanks, Allison.
Yeah.
If any of our people watching our Facebook Live have any questions for us, feel free to post those. We'll certainly answer those during our Facebook Live.
we had a question pop up. How many times can you get this treatment that you're doing right now in a year, let's say? How many days are in a year? How many times can you get this treatment? Yeah. How many days are in a year? Oh, every day. Got it. Yeah, I mean, really,
perfect answer.
There's no reason not to get it. But I would say, if we were working it into someone's skincare plan, once a month would be a great idea for this. So I'm going to go ahead and start the DiamondGlow. It is a little noisy. So you can see there's two tubes, one that's delivering the hyaluronic acid, one that's going to be taking the dead skin away. And I'm just going to adjust that here. So here, this is just kind of a different way of getting that exfoliation done.
I find this to be one of the best things to do before I have an event because it's infusing that moisturizer and really plumping the skin back up. There's a little redness right after the treatment, but it goes away. Would you say, Allyson, within 30 minutes to an hour?
Absolutely, yep. It can feel a little sandpapery, just kind of as we're getting that dead skin off. But because we're using the infusion at the same time, there's a lot more comfort to it than a traditional microdermabrasion and kind of elevates it to that medical grade.
Something that's really exciting too about the DiamondGlow product is they, as Allyson talked about, the different Skin Medica serums that she's using with this particular treatment. And as Skin Medica comes out with advances in their new products, such as our TNS A+ serum, you're going to start to find that we are able to offer some of those same ingredients and products that are available in the product line also with DiamondGlow. So for example, if you're a big user of the TNS Advanced Plus serum, you will be able to receive a DiamondGlow treatment using that same human growth factor technology that's in that product, which is super exciting. The other thing to note too about some of these services is that they are part of the Brilliant Distinctions program. So we work with all our patients to make sure you're part of that program so that you can receive savings and rebates on those various treatments.
So a question, and Dr. Clinton is answering as well, which is great. But Allyson, from your perspective, how is the DiamondGlow different from regular microderm?
So the DiamondGlow, we're using a diamond head tip. So it stays very consistent in the depth of exfoliation that we're getting. There's all different levels that we can do, but by using the diamond head tip, that consistency is key versus more of the kind of sand crystal blasting microdermabrasion. Also, the big thing here is that dermal infusion at the same time, kind of getting right into those pores as we're getting the dead skin off. Really that kind of 3-in-1. So exfoliation, extraction, and infusion.
Wonderful. Well, I think we're going to step out.
Perfect.
Thank you for allowing us to join you on this treatment. Thank you, Susan. When you guys see Susan on the streets, you're going to wonder where she got that beautiful glow. That's from